tell us a little bit about what EMDR is, what it stands for, and kind of how you work with clients using that modality?
Sure. So EMDR stands for Eye Movement Desensitization and Reprocessing.
Wow, fancy name.
Fancy. That's why they call it EMDR, because you can't say that too many times. It's something that I use very often with my clients. So EMDR, it's a modality of therapy aimed at working on trauma, trauma and traumatic events. Just because EMDR is meant for trauma, that doesn't mean that we can't use it on, well, I like to say that we use it on painful life events, because I don't think that certain things can be labeled as quote unquote traumas, and that definition is different for everyone. So I use EMDR on painful life events. So what we do in EMDR is we take a memory, a painful memory, and we process it using eye movements. So sometimes I might move my hand like that and have people follow me with their eyes. Sometimes there's equipment, and then there's also other ways to do the what we call bilateral stimulation. So it isn't always eye movements. It could be any sort of stimulation on alternating sides of the body.
So it's happening while the person is talking about the difficult memory?
Yes. So so what I do is I have someone bring it up, and then we do the bilateral stimulation, whether it be eye movements or what have you, depending on the person. And there isn't any talking while the bilateral stimulation is happening. It happens for about 20 seconds, and then we stop, and then I check in and say, what happened? Where did you go? And then the person gives me an update or kind of a report of where it is that their mind went, and then most often I say, go with that.
Okay.
And then we continue with the bilateral stimulation.
So wait, just so that I'm clear, because during the stimulation or the eye movement, the person is not speaking, they're just they're thinking and visualizing the event?
Correct. So I like to bring up a memory almost as if it is a movie. And then I ask people to pause that movie on the worst part. So I say, what image is on that screen of the worst part of that movie? And then I bring them right there with the feelings and the thoughts associated with that image. And I have them start from there. And then we begin the bilateral stimulation.
And then so you pause, and then you move the movie along?
And then so the question I ask is, what came up? And then the client reports whatever it is that came up.
And that's the next frame?
And then most often I say, go with that.
Okay.
And
unless he's thinking about cheeseburgers.
Unless they're thinking about cheeseburgers. And so to speak a little bit more about EMDR, and it's really free association.
Gotcha.
It's free association, and the theory is that the mind takes itself to wherever it needs to be healed. So in painful life events, a lot of that content, a lot of that memory is what we call unprocessed. So it's unprocessed, and so it's kind of stuck there. And while we're doing bilateral stimulation, what we're doing is we're sort of processing or digesting that piece of that painful life event that was never processed or could never have been processed. And we do it in a systematic way, in a safe way, where we can where we can process and get through these things.
Gotcha. Okay. Two questions that come up for me. One, there's been some literature of late talking about how trauma or painful events is not only a cognitive process, meaning it's not only thinking, but it involves thinking, emotions, and a physical body as well. So it has sort of that triad. Do you find yourself kind of noting that? Is anything comes up for these individuals when you guys are doing, focusing on some of the painful events through EMDR?
100%. So when someone brings up a painful life event, we talk about the negative thoughts that they feel, that they believe to be true right now, and we also look at any sort of body sensations that are going on. So we take those two along with the image, and we put that all together, and then that's where we go. And then when I check in with folks, I ask, is there any disturbance? And so what they do is they bring up the image and they notice if there's any disturbance in their body. So it's very common that someone says, oh, I have a tightness in my chest. And then oftentimes I would say, go with that.
Okay.
So as we're processing, we're working on thoughts, memories, feelings, body sensations, everything that comes up. Because
Okay.
kind of like what you said, that's all tied into the trauma.
Gotcha. Okay. Great. Thank you for that. That definitely clarifies a couple of things for me, and hopefully.
This is Sam Vaughn for Sam Sports Report and Sam's Mental Health Day. Today we're going to talk about EMDR and how it can help you. EMDR has these little vibrators. You hold one in your hand, you hold another in your hand. It vibrates like a controller. And then you talk about your previous thought or trauma or anxiety or whatever. It helps reduce that feeling or helps it evaporate even. And you'll track psychologist's hand. Abuse trauma with effect of lingering for the rest of the life. Emotional scars can lifetime. However, EMDR treatment, you may be able to heal from these wounds. In the one experience, all participants were survived childhood sexual abuse, or 1/3 of these women were given to EMDR treatment, while the others were traditional individual treatment delayed. Those who received EMDR results in the survivor childhood. There's a link to that. And a control group shows that EMDR helps more so than group traditional therapy. Natural disaster survivors just experienced trauma and resulting in emotional pain and review. Each studies showed that EMDR helped survivors natural disaster have reduced symptoms of PTSD in 4 studies. The results after one session of EMDR, many students have determined that eye movement desensitization reprocessing treatment would help people with PTSD. A review research suggests that EMDR was the most effective than going without trauma, but it was also at least more effective than treatment, relaxation, active listening. EMDR could help with many forms of anxiety and study people with generalized anxiety disorder after treatment. 7 anxiety symptoms dropped below the diagnostic level. This is treatment after their condition that was so improved. They would receive diagnosis of GAD to show no signs of GAD at all. 2 months after treatment in patients who had the symptoms and treatment, all significant improvement in symptoms and anxiety. Could EMDR help for me? EMDR has shown studies that it helps with all of these things that are about to be listed. It might help you with EMDR, would help you people with a variety of mental illness and health conditions. Anxiety, panic attacks, PTSD, sexual abuse, violent abuse, or violent assaults or abuse, depression, bipolar disorder, dissociative disorder, eating disorder, personality disorder, and grief and loss, sleep problems, substance abuse problems, signs of trauma. If you understand more about it being traumatic events on this podcast, you can link the link to trauma. Click on the trauma link to listen to a podcast on trauma. Trauma is the best condition treated by EMDR. Experiences trauma, you may benefit from EMDR treatment. Trauma is disturbing the event that causes your extreme feelings of fear or concussion. You could have trauma if you have been threatened with an intentional assault, possibility of death. Signs and trauma include trouble functioning, work or home, problems with concentration, feeling ashamed, being afraid of, anxious, depressed, engaging in emotional outbursts, relationship issues, nightmare flashbacks, intrusive thoughts, avoiding trauma, feeling numb, using alcohol to mask your feelings. These symptoms may ring for you and maybe face traumatic experiences. If so, please contact the Lucan Center for help you need, whether you benefit from EMDR treatment or some other modality. We can help you.